Nearly 1 million people in the United States are living with Parkinson's, and symptoms associated with the disease can vary widely from person to person. Many of the most common symptoms of Parkinson's can affect a body's ability to control movement. Today, an in-depth look at deep brain stimulation in Parkinson's and one woman's determination to be one step ahead of her symptoms. I'm Ereka Vetrini in Lexington, Kentucky. Access Health starts now. Parkinson's is a neurodegenerative disorder characterized by motor dysfunctions that result from the loss of dopamine-producing brain cells, a substance that helps with smooth and coordinated muscle movement. In Parkinson's, eventually the brain cannot make enough dopamine to control movement properly, and motor symptoms often start to appear. According to the statistics, most people diagnosed with Parkinson's disease are aged 60 years or older. However, an estimated 5 to 10% of people with the disease are diagnosed before the age of 50. Anne Hanley was diagnosed with Parkinson's disease at 49.
I grew up in a small town in the west coast of Ireland called Ballina, County Mayo. I've been married 34 years to my best friend, David. We grew up together in Ballina. We rode ponies, we attended horse shows and rallies, and horses are what really brought us together. We got married when I was just 28. We have 3 kids, Ian, Emma, and Ben. We moved from Ireland to Kentucky in 2001. We currently live in Winstar Farm, and my husband David works there. He's the general manager. Kentucky is like Ireland in that it's really green. I love living here. I intermittently noticed, that I had a lot of shoulder pain. I got to a point where my shoulder didn't seem to move, my elbow didn't swing, my arm didn't swing. So I went to University of Kentucky, saw a movement disorder specialist there, and I will never forget that day. It's like it happened yesterday. I'm sitting on the edge of the bed in the consultation room. My husband is sitting in the chair. And he said, "You have Parkinson's disease." And when I heard that, I remember absolutely focusing on the white wall ahead of me, hardly being able to breathe. I was just in a complete daze. Those early days were really, really dark because I was a stay-at-home mom. My kids were grown up. I was looking forward to a future where I could help my husband on the farm, where we could travel, go racing more, and have a more active lifestyle. So I saw my future just drop off over a cliff, like it's not going to happen.
Dr. Craig Van Horn is a nationally and internationally recognized expert in neurosurgery. He specializes in the diagnosis and treatment of movement disorders.
One of the fascinating components about Parkinson's disease is that no 2 patients are the same. Some patients develop symptoms very early on and may progress very slowly. Some patients may get it later on in life, and the type of symptoms are very different as well. So some of the main features of Parkinson's disease include tremor, or rigidity, or stiffness, or gait and balance problems. And again, not every patient has all of those, but maybe some combination of those symptoms. But the one symptom that most all patients have is the slowness of movement, the bradykinesia. Yet the movement symptoms can have a dramatic impact on patients' lives.
Enormous progress has been made in the treatment and understanding of Parkinson's disease over the last 50 years. These include treatments that aim to control the symptoms of PD without the problematic side effects seen with the currently available treatments. I'm traveling today to meet with Anne Hanley, who we heard from earlier in the show. She's invited me to spend the day with her at the stunning WinStar Farms, one of North America's leading thoroughbred breeding and racing operations.
And thank you so much for inviting me to WinStar. It's spectacular.
I'm so pleased you can be here today, Ereka.
You've got to promise to show me the horses later, though.
Yeah.
So I just want to take it back a bit. We know that your diagnosis period was a dark time for you.
Yeah.
So tell me, what was the treatment plan that was prescribed for you when you were going through this dark period?
Well, when I was diagnosed in the beginning, I was offered a frontline medication after the first year. So I took the medication, lost a bunch of weight, about 50 pounds, looked like a coat rack, and didn't do well, sank into terrible depression, felt miserable, was a completely different personality and character to what I am normally. I was a person that loved life, very active, a social butterfly, and this pretty much robbed me of everything. I felt conspicuous anywhere I went. I felt people were looking at me. I felt I couldn't move smoothly. My gait was affected. My walk was stooped, so I had constant pain.
So the overall goal of treating a patient with Parkinson's disease is to help get the symptoms under control. Early on in the disease, medications can be quite effective for many patients. And if a patient can take a medication, a single medication, maybe 3 times a day, and continue on with their daily activities, that can be quite a positive thing. But the problem with Parkinson's is that it will continue to progress. As it progresses, more symptoms pop up, and some of the existing symptoms get worse. And the problem with this becomes a burden of medication management.
You did make a decision to pick yourself up and move forward. Tell us about that.
Well, the decision moving forward was taking the frontline meds away. It was researching. I got on the Michael J. Fox website. That helped me tremendously. I became an ambassador for him, and that opened up webinars, seminars, training. It opened a window into a Parkinson's that before had seemed totally black. But now there was research, there was exercise, which was really important, and I didn't realize it at the time. I was active, but I upped my activity level to slow the disease down. And I had a few years where that certainly helped.
And I know how important exercise is for people who are managing Parkinson's.
Absolutely, it's incredible. Makes a huge difference. Why don't we just go for a walk on the farm, and I'll show you a little bit now.
I would love that.
Okay.
Coming up, how doctors are using deep brain stimulation to ease the movement symptoms of Parkinson's. Deep brain stimulation, or DBS, has been approved for the treatment of movement disorders since the 1990s. But what exactly is it, and how is it used in Parkinson's? Here's Dr. Van Horn with more.
So deep brain stimulation is a surgical treatment for Parkinson's disease where we pass a stimulating electrode down to pass electrical current that will alleviate some of the motor symptoms of Parkinson's disease. The right time for a patient to consider deep brain stimulation is when a patient is experiencing symptoms on a daily basis that are not well controlled with medication after multiple attempts of adjusting the medications. However, some symptoms that don't respond to medication, such as tremor, can be very effectively treated with deep brain stimulation. So one of the things that we really do is to go through all of the symptoms that a patient has and identify those symptoms that really are what we consider targetable with the deep brain stimulation surgery.
Welcome to my world.
Oh my goodness.
Well,
They are beautiful.
beautiful.
So tell me, Anne, what
We have
lives here?
We have 20 stallions that live here. Household names, some of them. Really important, distorted humor. We have Improbable, Breeders' Cup winner, and the list goes on and on, 20 of them. All beautiful. Yes, you are.
You are gorgeous.
You are.
To be this close.
You are.
And at some point you got involved with the University of Kentucky, correct?
Yes, I did. I was looking at Parkinson's research in the area, and the university had a Parkinson's research department. I called him up and he said, we have a neurosurgeon coming from Boston who is involved in research and who does deep brain stimulation. Dr. Van Horn arrived at University of Kentucky. He made time for me. I met him. He was really kind. He let me shadow him, took me into the OR, had me observe, and once I saw the very first deep brain stimulation, my mind was completely blown. I was just so enthralled by what they could do.
And the patients you were seeing and you were communicating with, you developed relationships with them.
Yes, I certainly did. And I would see them afterwards, and in clinic they would tell me about the great outcome they all had. And for 7 years I worked alongside Dr. Van Horn and the patients. I learned so much.
And the whole time while you're working alongside and seeing these patients, what were your symptoms like?
Oh, they were getting steadily worse daily. And we noticed it, Dr. Van Horn noticed it, I noticed it. I couldn't walk 50 yards. I had severe back pain, was stooped, tremor, stiffness, just was, and on top of that I was slow. Slow as a wet week, just couldn't pull it together. It took me ages to get from A to B. We decided we needed to start on medication. Dr. Van Horn prescribed it. I duly took it in small doses at first because I was worried about the fact that I could have side effects.
So how did they work?
My symptoms steadied up. Even though the tremor didn't go away, it lessened. Everything improved, but I was no way perfect or far from feeling like I wanted to keep going on full time. And suddenly I realized, you know, I needed to take charge and do something. Dr. Van Horn said, I think you'd be a good candidate for DBS.
For patients to be considered a good candidate for deep brain stimulation, they have had the symptoms for perhaps 4 or 5 years. They have a true diagnosis of idiopathic Parkinson's disease. And we also want patients to be cognitively intact. If a patient has a significant cognitive deficit, they may not be a good candidate for deep brain stimulation. This is not a cure, and it doesn't always affect all of the symptoms. And even with the motor symptoms, it may not get all of the motor symptoms under control. So there are limitations to the therapy, but what we really shoot for is an improvement in the quality of their life. And this is something that we work out together. They actually have to feel better, and that has to have a positive impact on their life.
More than a quarter century of clinical trials and patient experiences have tested the safety and effectiveness of treating Parkinson's disease with DBS. Deep brain stimulation surgery involves implanting a device that uses electric signals to regulate brain activity.
So one of the advantages with deep brain stimulation, as well in terms of Parkinson's disease as a progressive disorder, as symptoms change, patients can come back to the clinic and we can adjust the deep brain stimulator to try to capture any additional symptoms that may be developing. Deep brain stimulation works 24/7 and really tends to smooth out the clinical course throughout the day. Reducing fluctuations in a patient's therapy is quite important. When patients ask, what is it going to do for me? What are the benefits of the surgery? The deep brain stimulation really smooths out the therapeutic benefit. You really minimize and decrease the amount of off time that a patient may experience. In addition, we are able to reduce medications in many cases. Depending on the target that we pick, we may be able to reduce medications by quite a bit, or we may be able to use the same amount of medications but more effectively throughout the day. Deep brain stimulation can also affect some symptoms that are not affected by medication. As we had mentioned, tremor sometimes is not responsive to the medical therapy. But deep brain stimulation in the right target can be quite effective in tremor control. So if you're a patient with Parkinson's disease and you're struggling with your symptoms and you're wondering what to do next, please don't be afraid to ask your doctor about different options. And it doesn't mean that you're signing up for a surgery, but you can at least be informed as to what options are available for where you are.
Here, Ereka.
Thank you so much.
A mint julep for two Kentucky ladies. Cheers, me dears.
I love it. Anne, oh gosh, this is so beautiful. So Anne, you got deep brain stimulation. How did it feel to be the patient this time?
Well, it was the strangest thing being the patient and knowing the whole team involved. So it was truly amazing. I won't say I was nervous. I was confident. I was easy.
Can I see the device?
Yes, sure. I have a rechargeable device which I can charge up every day or charge a couple of times a week. I pop this, we call it a puck. I pop this into this little collar. It's weighted down on the other side and it pops around my neck. When it finds the target, see, it stops.
So it's charging right now?
It's charging right now. It's as simple and easy as that. This is the actual battery itself. This is smooth, contoured, round, and it's slim.
And you don't feel it at all?
No, don't
Incredible.
even know it's there.
Incredible.
So it's just there in my chest and you wouldn't see it. So that's the magic.
Incredible. So Anne, I've been walking around with you all day.
Yeah.
From the looks of things, you're extremely active and things are going well.
Yeah.
What have been the benefits and are you happy you made the decision?
Oh, I just wish I had done this so much sooner. It's like going from watching a movie in black and white to a big screen Technicolor. And the world has opened up to me. I can go racing. I'm not concerned about people looking at me, and my confidence is back.
I didn't notice any today.
There's nothing. Nothing.
Nothing.
You can't even make me shake.
I don't want to make you shake.
So my message to everybody is educate yourself. Be an advocate. Ask the questions. Know about deep brain stimulation. Even if you think you're too young, it's too soon, don't think of this as a last resort.
And thank you so much for having me here today, for sharing your story and your journey. You are truly an inspiration. I mean that.
Thank you, Ereka. Thank you for coming and visiting.
Cheers.
Cheers, me dears.
Cheers.